Tirzepatide. Tirzepatide is a novel antidiabetic drug that acts as a dual GIP and GLP-1 receptor agonist. Because it activates both incretin pathways, it produces greater glucose lowering and weight loss than many traditional GLP-1 receptor agonists. Mechanism of action. Tirzepatide stimulates both GLP-1 and GIP receptors, triggering a cascade of metabolic effects. The first effect is enhanced insulin secretion. Tirzepatide increases glucose-dependent insulin release, meaning insulin secretion is stimulated primarily when blood glucose levels are elevated, helping reduce the risk of hypoglycemia. The second effect is glucagon suppression. By reducing glucagon secretion from pancreatic alpha cells, hepatic glucose production decreases, contributing to lower blood glucose levels. Another important action is delayed gastric emptying. Food moves more slowly from the stomach into the intestine, resulting in slower glucose absorption and reduced postprandial glucose excursions. Finally, tirzepatide increases satiety and reduces appetite. Patients feel fuller for longer, consume fewer calories, and experience significant weight loss. Adverse effects. Among the common adverse effects, the most frequently reported are nausea, vomiting, and diarrhea. These symptoms are usually dose-related, tend to occur during dose escalation, and often improve with continued treatment. Another common effect is reduced appetite, which contributes to the significant weight loss observed with tirzepatide. There are also some less common but important adverse effects to remember. Pancreatitis is a rare but potentially serious complication and should be suspected in patients who develop severe, persistent abdominal pain. Injection site reactions may occur because tirzepatide is administered subcutaneously. In addition, gallbladder disease, including cholelithiasis and cholecystitis, has been reported. Hypoglycemia is uncommon with tirzepatide alone, but may occur when combined with insulin or sulfonylureas. Clinical use. Type 2 diabetes mellitus. Tirzepatide is indicated when glycemic control is inadequate with lifestyle measures and/or oral antidiabetic drugs. One of the major advantages of tirzepatide is its ability to produce substantial reductions in multiple measures of glycemic control. It significantly lowers HbA1c, which reflects average blood glucose over the preceding 2 to 3 months and is a key marker of long-term diabetes control. In addition, tirzepatide reduces fasting glucose, helping improve baseline blood sugar levels, and lowers postprandial glucose, thereby controlling the glucose rise that occurs after meals. Clinical use. Obesity and weight management. Another major clinical use of tirzepatide is obesity and weight management. In fact, it is considered one of the most effective pharmacologic treatments for obesity currently available. The remarkable weight loss produced by tirzepatide is primarily due to two mechanisms. First, it causes appetite suppression, helping patients feel less hungry throughout the day. Second, it leads to reduced caloric intake by increasing satiety, so patients feel full sooner and eat smaller meals. These effects are a direct consequence of its dual incretin action on GLP-1 and GIP receptors, which influence appetite regulation and energy balance. An important clinical point to remember is that tirzepatide can be used in overweight or obese patients with or without type 2 diabetes. Therefore, its benefits extend beyond glucose control and include significant and sustained weight reduction. Clinical use. Cardiometabolic risk reduction. Beyond its effects on glucose control and weight loss, tirzepatide may also contribute to cardiometabolic risk reduction. This is important because patients with obesity and type 2 diabetes often have multiple cardiovascular risk factors. One major benefit is a reduction in body weight, with many patients experiencing significant and sustained weight loss. Tirzepatide also improves blood pressure, producing measurable reductions in both systolic and diastolic blood pressure. In addition, favorable changes are seen in the lipid profile, including improvements in cholesterol and triglyceride levels. At the same time, tirzepatide provides durable glycemic control with sustained reductions in HbA1c and fasting glucose. Together, improvements in body weight, blood pressure, lipid profile, and glycemic control may help reduce overall cardiovascular risk in high-risk patients. Key takeaways. The first point is the dual agonist advantage. Tirzepatide activates both GIP and GLP-1 receptors, allowing it to target two incretin pathways simultaneously. This dual mechanism contributes to superior metabolic outcomes, including greater glucose lowering and weight loss compared with many traditional incretin-based therapies. The second point is its broad clinical utility. Tirzepatide is effective across multiple clinical settings, including type 2 diabetes, obesity, and cardiometabolic risk reduction. This makes it a versatile therapeutic option for patients with complex metabolic disease. Finally, consider its manageable safety profile. Gastrointestinal side effects such as nausea, vomiting, and diarrhea are common, but are usually manageable and often improve over time. However, rare serious risks, including pancreatitis and gallbladder disease, require appropriate monitoring.